hurting still today. Lord, folks have just been through a hurricane, and then we have the COVID situation. Father, we as a country need your help. I ask, Father, that you would bless our state, the decisions they've made. Pray that you continue to give them wisdom. And now, Lord, our commissioners here in the Commissioner's Court and the judge, I pray, Father, I ask, Lord, that you'd continue to give them wisdom. Thank you, Lord, for their dedication and their service. I pray, Lord, in this meeting today that your blessing would be on it. We also pray for the sheriff, his staff, the officers, those that are in the field, in the courts, and in our correction facilities. Father, we pray for them. Lord, we do look to you for help in these times, these difficult times. I pray that our response as individuals and as a nation would be right and honoring to you. Lord, we look to you for that help that comes from you and the wisdom that comes from you. And we ask these things in Jesus' name. Amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible.
Thank you, Frank.
Yes, sir. Thanks, sir. Yes, sir.
Good morning.
Good morning.
So, members of the court, we have various announcements as it relates to the agenda this morning. First, let me say that when we go to the claims register, that while there are claims on there dealing with rental assistance, we're going to hold those claims for just a short while. Normally, we receive a file from the state because of their rental assistance program, so we can match it with ours to ensure there's not a duplication. Once the county auditor receives that file and compares it to the claims, then we will be issuing those checks. Second of all, members of the court, I believe that Commissioner Johnson this morning has an appointment to the CPS board that we'll be doing when we get to appointments to various boards. Also, as it relates to the budget, that today, and when we go to the briefing section, that the budget director has some items that she would like to discuss with the court. And then finally, members of the court, as we have done in the past, we're going to take some of our items out of order. When it comes to the administrator section, we're first going to go to briefing, and we will hear item 12D, which is the hospital district's FY21 proposed budget. After that, we will then go to Mr. Tenazia's report, which is item 12A on the agenda. Also, Your Honor, we do have several audience participation forms this morning.
Yes, sir. Thank you, Mr. Manius. Court members, you have before you the minutes of our regular meeting of August the 24th.
Move for approval.
Second. We have motion and second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. We have a couple of proclamations, and then we have our employee recognition. The first proclamation today is on national preparedness, and I know David and William are here, and if y'all will come on down. You know, these folks work very hard. I'll move approval of the proclamation.
Second.
We have a motion and a second. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. They've kind of been on 24/7 for the last 18 months because of the COVID. And in addition to that, they've got everything else going on with regards to the weather, with regards to hurricanes, with regards to everything else. We appreciate very much the work that y'all do. Thank you very much. Get in here in the middle and no, I'm not getting in the middle. This is my proclamation. I know we have an extra flash. Go ahead and make any comments that y'all like to make, but again, thank y'all very much.
Thank you so much for all of the support. Last 18 months, man, what a ride. It's been a little bit of everything. I don't think we've missed hardly anything in the way of disasters, but we're hoping for better days. It was a very beautiful morning this morning when we got up. But again, thank you. It's been an all hands on deck situation. And by having this month to help remind our citizens and our friends and neighbors that it's never too late to prepare. So please continue to prepare for the future, because we never know for sure what's coming. And we again thank you so much for your support.
Thank y'all. Commissioner Brooks.
Thank you, Your Honor. I have a proclamation recognizing Prostate Cancer Awareness Month. I thank the Lord for one more year of life, because it was in 2015 that I had my prostate cancer surgery, and I have been cancer-free since that date. So I know well the need for men to be tested for prostate cancer. I know well the survivability odds based on early detection versus late detection. Prostate cancer is a disease you do not need to die from. Check yourself, men, and choose life. I'd like to read this proclamation into the record. Whereas prostate cancer constitutes 20% of all male cancer diagnoses and 10% of all male cancer deaths. And whereas in Texas, an estimated 14,200 new cases of prostate cancer and an estimated 2,180 deaths will occur in 2021. And whereas prostate cancer is the second most diagnosed cancer in American men, behind skin cancer, and the second leading cause of death in men, behind lung cancer. And whereas this year approximately 248,530 men will be diagnosed with prostate cancer in the United States, one man every 2.1 minutes. And roughly 34,130 will die from the disease. One man every 15 minutes. And whereas 1 in 8 men are diagnosed with prostate cancer in their lifetime, men of African ancestry, firefighters, and men with family history are at highest risk. Men of African ancestry have a risk factor of 1 in 6, and they are also 2.1 times more likely to die from the disease. And whereas prostate cancer not only affects men, but also affects their families and friends. And whereas prostate cancer education and early detection strategies are critical to saving lives and preserving and protecting our families. And whereas all men are at risk of prostate cancer. The citizens of Tarrant County are encouraged to increase their personal awareness of prostate cancer and of the importance of early detection. Now, therefore, be it resolved that we, the Commissioners Court of Tarrant County, do hereby proclaim September 2021 as Prostate Cancer Awareness Month and urge all citizens to take the initiative to increase public awareness in our community to prevent, detect, and treat this disease. In witness whereof, we have hereunto set our hands and caused the seal of Tarrant County to be affixed this 7th day of September 2021. In your honor, I move approval.
Second?
We have a motion and a second. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Here to accept this proclamation this morning is my good friend Wolfram Blattner, past president of the North Texas Prostate Cancer Coalition. Wolf, please join me at the podium.
Good morning.
Hi.
I've already been introduced.
Now, wait a minute. You got to get your picture took here first. Don't get started too quick here. He's got to get a picture with you.
This first.
Okay.
And any other man in the room who is a prostate cancer survivor, please join me up here. All right then. They are lucky this morning. This morning.
Go ahead.
Now you can talk.
All right. Thank you. If everybody forgot, I am Wolfram Blattner, past president of the North Texas Prostate Cancer Coalition, and I live in neighboring Parker County. I'm a 16-year prostate cancer survivor, so I'm 10 years ahead of Commissioner Brooks. I know I owe those 16 years to early detection. The proclamation provided to you includes statistics that all men and women should become aware of. The purpose of presenting this proclamation is to use this opportunity and platform to address the citizens of Tarrant County, both men and women who are watching or will watch the video of this meeting. Hopefully, it will not be glossed over as something unimportant. Citizens should be aware of the disease that they can discuss with their doctor and take appropriate actions. We are hoping that the county can make the information available to the public. This disease can strike any man. Its occurrence can be detected and monitored by a simple blood test that measures prostate-specific antigen, or PSA. Understandable, COVID-19 right now is on the high priority list. However, we should not ignore other health issues. Wheels for Wellness is offering free prostate cancer screening, blood test only, so nothing to be afraid of, on Saturday, September 18 in downtown Fort Worth. Awareness and early detection are still key to defeating this disease. There are several treatments available once cancer is found. The internet has a wealth of information on this disease. If citizens want further information, they can Google North Texas Prostate Cancer Coalition. October is Breast Cancer Awareness Month. Prostate cancer is equal in occurrence and importance to breast cancer. So let's make September Prostate Cancer Awareness Month. Thank you, Judge Whitley, Commissioner Brooks, and the Commissioner's Court for the opportunity to raise citizens' awareness of this major health issue. Thank you.
Thank you very much for being here today.
And Judge, let me just add that Tarrant County, in partnership with John Peter Smith Health Network, is providing PSA screening, specifically targeting men working for Tarrant County. The dates of the screening are as follows. September 13th, Family Law Center, 7 to 9 a.m. September 14th, Precinct 3 Garage, 6 to 8 a.m. September 15th, Precinct 4 Garage, 6 to 8 a.m. September 16th, Precinct 2 Garage, 6 to 8 a.m. September 21st, the Plaza Building, 6 to 8 a.m. And September 23rd, Precinct 1 Garage, 6 to 8 a.m. These are posted somewhere, I'm sure, on our website, perhaps?
We received the notices today. They'll be up by this afternoon.
Be on the website. Thank you.
Thank you, Commissioner Brooks. Any other announcements at this time?
Yes, thank you, Judge. I do have a brief one. This really is concerning anyone who regularly travels along State Highway 360 or Interstate 30. So that's probably quite a few of us. The final 2 legacy bridges in the interchange project that will cross 30 will be demolished. And the schedule starts this Friday, September 10, at 7 p.m. through Monday, September 13th at 5 a.m. So I know that is obviously a very highly frequented interchange. We will all be thankful once it's done. This is a big step in that process. So just please be mindful of that as you are traveling about. For more updates, go to www.keep30360moving.org, and of course follow the social media handles accordingly. Thank you.
Any other announcements? Okay, it comes, it's that time of month. Every week's been that time of month for the last couple of months, but this is our regular September employee recognition, so we're not catching up. And the way this works for you 5 years, you rookies, is that you listen to what sounds maybe like your name, and you stand up. If you know alphabetically where you are, and what I say doesn't agree with what you've been called all of your life, you still stand up. And then we'll get to the end of that particular group, and then we'll move on to the next one. Again, this is one of my favorite times because it gets to recognize those folks whose passion is public service, and those folks who make Tarrant County such a great place to live, to work, and to raise a family. And I can't thank you enough for everything that you do. And the first one is going to be one of those people. You're A in the alphabet, so please stand up. Eduardo Humana. Yeah, he's not here. I knew that was going to happen. He's with the Sheriff's Office. Julie Cathy with the Criminal District Attorney's Office. Jo Beth Embry, Human Resources. It's nice to bring your own cheering section. Charlene Hervey, Public Health. Tiffany Kopalowicz, Criminal Courts. Edith Knight, JP 4. Ann Pena, Sheriff's Office. Tyler Rienthong, Tax Office. Patrick Serrano, Sheriff's Office. Sandra Sotelo Guzman, Public Health. Scott Stafford, Precinct 2.
He's not able to make it.
These are our 5-year employees. Let's give them a hand. Thank you. Now for our 10-year employees, James Box, Purchasing. Brent Brown, Sheriff's Office. James Greenlee, Sheriff's Office. Marcus Hanna, Criminal District Attorney's Office. Matthew Hardy, Criminal District Attorney's Office. Kevin Hollis, Public Health. Rosenbaum Rodriguez, Domestic Relations. Yeah, I'm sorry about that because I got a feeling I wasn't quite on target with that one. Tiffany Smith, Public Health. Leanna Tarango, Sheriff's Office. Marty Ergenhart, Sheriff's Office. These are our 10-year employees. Let's give them a hand. Thank you. 15 years, Jonathan Boyce, Sheriff's Office. David Crane, Sheriff's Office. Billy Daniel, Criminal Courts. Esmeralda Garcia, Sheriff's Office. Beverly Harrelson Thorpe, Sheriff's Office. Preston Agori, Sheriff's Office. When I see them grinning back there, I can really tell that I'm not doing too well. These are their compadres. Diana Jackson, Information Technology. Keisha Jackson, JP number 8. Richard Nutt, Criminal District Attorney's Office. Waylon Parks, Precinct 1. Wayne Pollard, Housing. There's Wayne. Lonnie Pruitt, Sheriff's Office. Nettie Talbert, Sheriff's Office. Nancy Thurman, Juvenile Services. Joseph Williams, Juvenile Services. Tanetta Young, Sheriff's Office. These are our 15-year employees. Wait a minute. Did I forget Roger Faraday?
Yes, Your Honor.
I just skipped right over you there. I was so worried about Elsmeralda that I just skipped right over you. I apologize. Thank you.
No offense, Your Honor. Thank you.
See, they do kind of keep me out of trouble most of the time. It's hard, I know. 20 years employees. Daniel Blanco, Information Technology. John Briggs, Medical Examiner's Office. Sonia Cisneros, Information Technology. William Eason, Precinct 2.
He's not able to make it.
Cameron Wheat, Sheriff's Office. Cameron. And Larry Wilson, Human Resources. Now for our 20, this was a little challenging because when we got in here this morning, this computer wouldn't call up the ones that I had done, so we had to get them all printed off. And so my highlights and all of my little notes are not going to be here, and so it's going to be very interesting. First is Cornelius Carey, Juvenile Services. Welcome, sir. Started out in juvenile services in the detention area, then went to the placement section. I asked him for memorable moments. I said, did any of your juveniles ever get away from you? He said, no, I've been able to keep them all in tow. He said, when I asked him what he liked most, he said it was his coworkers, without question. He said there have been a lot of folks who he has trained with and have helped train him that have retired. He said the supervisors have always been there ready to help, to answer questions. He talked about Carey Cockrell, who I call Curly, just as bald as he could be. He said it's all been good. He said the thing that I just love about my job is that I get to help kids try to get back on the right track. Cornelius, thank you very much for your 25 years of service. Next was James Daniels. He wasn't going to be able to make it today. He has a grandson that lives with him who has not been vaccinated, and he was very concerned. I mean, I have to say, we've talked a little bit about whether we should be continuing to do this. I look out and I see the masks, and I appreciate that. But he wasn't able. James Daniels with the Sheriff's Office, Green Bay, 25 years of service. If you see him, tell him that we appreciate his service for the county. Next is Lavia Delgado, Public Health, 25 years. Started working part-time with Public Health. Has really been here for about 27 and a half years, is I think what we decided. Works in the WIC area, started out in clerical, still working in that area. Memorable moments, she said a couple of years ago she had a young lady that came in right at closing time. The lady just seemed real depressed. She said she could just tell this lady was at her end. And she sat there and she talked with her. She gave her some numbers to help get some additional assistance and work with the lady. She said the lady came back within the next couple of days and said she just didn't know what she'd have done if she hadn't stayed and talked with her. And those are the kind of things that our people go that extra mile. And sometimes we may not know, but in this instance, I think you saved her life. And there have been other instances where we feel people in the corrections area and the juvenile services area, public health, where they'll take that extra time. And they do make, and juvenile services will say, sometimes somebody will walk up to me in a grocery store and thank me for the time that they spent with me trying to get me back on the right track. She says, I absolutely love helping families in needs. And she said, I just love talking to these new moms and helping them to understand that what they're experiencing in many times is normal, and just working through them and working through that. Lavia, we can't thank you enough for the 25 years of service you've given to Tarrant County. Thank you very much. Next is Anna Moore. She wasn't going to be able to be here today. She is in the sheriff's office. What she said was that she has always had supervisors who were always very understanding. She'd had some health issues. She's had some, loss in the family. And she said, my supervisors were always there, and my coworkers were always there to kind of stand around me, to help prop me up, to help me get through whatever the situation was at that time. And again, that's what Tarrant County is all about. When you see Anna, please tell her how much we appreciate the 25 years of service. Next is Jeanette Wallace. Started out as receptionist front desk, works for Ann Smith. handles family medical leave, which has been a little challenging, maybe the last 18 months. She said, over the years, I've seen a tremendous amount of change in technology. She says, I remember when I first came here, we were doing everything by paper. It would take we'd burn up copiers, just going through things. Another memorable moment was Gerald's passing, and I think the whole department, it was shocked. Everybody in the county was shocked by that. She said, I love the benefits. I love the number of people that she's had a chance to meet, all the friends that she's made. She says, I've absolutely loved working for Ann. She'll be retiring at the end of this month, and we're going to miss Jeanette. Jeanette lost her son in Afghanistan, and the county surrounded her and helped her, the members of the court. She said the one thing she remembered was putting the flags at half-staff. And Jeanette, we can't thank you enough, not only for your service to Tenure County, but for the sacrifice that you've made and that your son made for this country. Thank you very, very much. Next is Sam Adami, Public Health, 30 years. Started out in the air control ozone program, still works in the environmental area. Memorable moments. Some of y'all may remember when Burger Lake had a little bit of a problem. They had to close Burger Lake down. Well, he worked on that one. He said, the thing I like most is my coworkers, the people I've had a chance to work with. He said, I really enjoy working with public and helping them to get the answers. He also had done some work with TCU on some kids programs in targeting obesity and diabetes. He had 2 kids. When I talked with him 5 years ago, he had 2 kids, one that was just graduating from high school, and then one that graduated from Arkansas with an engineering degree. He said, I really enjoy working with a group of folks that really care about others. When I asked him what's kind of happened over the last 5 years, he said, well, at least for the last 18 months, it's pretty much been COVID-19. He's worked both in the testing areas, the pop-up, the mega centers for testing, as well as for vaccines. Both of his kids graduated and are chemical engineers. His daughter's working in Houston. His son, he's gone back to get a law degree at Texas, another one of these lawyers. He said, what I enjoy is the fact that, well, I'm going to take that back. Enjoy is not the right word to use. He said, in COVID, we've seen it bring out the best, but unfortunately, we've also seen it bring out the worst in some people. And that's very, very true. He said, the thing that affects me the most is I'm coming face to face with people who need tests so they can get into the hospital to visit a loved one for the last time. And that's what we've seen over the last 18 months that has affected, obviously, our own employees through public health, but it's also affected folks throughout our community. And again, as we've said, as he said, brings out sometimes the best, sometimes, unfortunately, the worst. Sam, thank you very much for your 30 years. Next is Lisa Callahan, Assistant District Attorney's Office, 30 years of service. Started out in the DA's office as misdemeanor attorney, as most do. She spent a lot of time in the specialized crimes area against children and in gang homicide. She's now the assistant chief in the misdemeanor area. Memorable moments, the Opal Jennings case, some other capital murder cases. She said one was in the courtroom and the family erupted, I guess, at the reading of the verdict, and the judge dented his bench. He was beating the gavel so hard. She said, when I asked her what she liked most, the benefits, when you have kids, it's hard enough to be a working mom, and it's great to know your employer appreciates you. She worked actually in Harris County for 4 years before she came up here. She said, when I talked with her 5 years ago, she said she got promoted and that she was training the young lawyers, and she really enjoyed that. And obviously, as assistant chief in the misdemeanor area, she's doing a lot of that training now. She said, I just don't think there are many folks that enjoy their work as much as I do. She's, in the last 5 years, she's tried many more cases. She's again, she gets some of these cases that we hear about. One where boyfriend kidnapped the girlfriend, still not ever found the girlfriend, but he got a life. So she's one of those that, I used to have this friend, and his name was Tom Myers. You may have even known Tom because he was with the DA's office, but it may have been even before you came around. And we'd have lunch every Friday, and we'd ask him who had sent down the river. Then he went to the other side, and so we quit talking to him. She also did a recent case where a man had killed his pregnant girlfriend. And that guy got life, or he'd get capital. Yep. So she's still sending them down the river, and we appreciate that. Lisa, thank you for your 30 years of service. Next was Peggy Dunlap, Constable Precinct 6. She was not able to be here today. So when you see Peggy, please thank her for her 30 years of service. Next is Debbie Edwards, CDC number 3. There you go, court reporter. Started out in County Criminal Court number 10 with Judge Gilfeather and then Judge Sorrells, and then moved to CDC number 3. Memorable moments. She said at one point in time, we had a big criminal trespass case, and there were 21 defendants. They had 4 juries, and they were hearing all 4 cases at the same time in different rooms. When I asked her what she liked most, it was the support of the county. She feels appreciated. It was such a family atmosphere in the court staff as well as the attorneys. She said, I feel blessed to have worked with 3 judges and plans to work until she can. She's, I guess, now working with Judge Cataloni. Both kids graduated from high school. Now let me see here, because that was 5 years ago. The daughter is now working for the district clerk.
Where'd he go?
Yeah, there he is over there. He's got him a quick exit to the cookies. Her son graduated from Hardin Simmons as a manager position with Best Buy. Son got married to a girl that I guess he grew up with, knew from church, started dating in high school. Her daughter, now I'm going to mess this up here. And I guess that's it right there.
Okay.
Again, she actually, court reporter. I know I had to read my own writing and try to interpret it, and that can be a little tough. But as I recall from what I've written down here, as I said, you were with Gilfeather and Sorrells for a long, long time, and then Judge Catalano was the DA in that court. And then when he got elected, he kind of talked with you about coming over and being his court reporter. And then he had to go and talk with Judge Charles to see if it was all right. But he said it was okay, and she's been there. Debbie, thank you so much for your 30 years of service to Tenure. Next is Tony Freeman, 30 years court reporter. There was several 30-year court reporters in this group. Started in criminal court, county criminal court number 9 as the court reporter, and has been there since it opened with Judge Carr. When she first started, again, she was typing paper with carbon behind it. Maybe I shouldn't have told that. She said, when I asked her what she liked most, it was the benefit. She said, the folks that I've had a chance to work with. When I talked with her probably 20 years ago, or 10 years ago, she says, no plans to retire, having too much fun. Watching everybody else's family grow up. Talked with her 5 years ago, still not thinking about retirement. Has a grandson. She was the chairwoman at that time of the Texas Court Reporter Conference. She said, I got to ride in a C-130, and that was an experience. Okay, so when I talked to her this time and asked her what had happened, she says, well, now I have a 7- and a 3-year-old grandsons and another coming in December, on my birthday, by the way. She said, I've taken up country dancing. And when she says she's taking it up, she means she's really taking it up, because as I could tell, I think she's dancing about 3 or 4 nights a week. She's done during COVID, they've been doing Zoom plays, so they hadn't been, just sitting back resting. She said, I absolutely love the family. I love the court. It's a big family. Now, I said, okay, as I understand, Judge Carr is retiring. And she says, yeah, but I ain't. I'm still not thinking about retiring. I'm having too much fun. Tony, thank you for the 30 years of service.
And Judge Carr is here.
I see Judge Carr. Judge Carr, stand up. Welcome. Thank you. That man has started many a program that he didn't have to do. He could have just done his business and gone, just kept on going, but he has really gone that second mile, and third, fourth, and fifth too. We thank you. I would say that he is a Marine, not a retired Marine, not an ex-Marine. He is a Marine. And he every year recognizes the Marine's birthday, and we thank him for that also and for his service. Next is Brian Lachey, the Sheriff's Office, the Judicial Division. Started out with the City of Covington, worked in the Arkansas Correction Department. Then he came to Tarrant County and started in Belknap area. Patrol and now judicial security since September of last year. He said the second night on patrol, he seized 30 pounds of marijuana from an abandoned house, and that was one of his memorable moments. He said, the people that I've had a chance to work with is what I like most about the county. 5 years ago when we had talked with him, he had just basically, and he said, not just me, but along with some private citizens, had pulled a person from a burning car and saved their life while he was on patrol. When I talked with him this time and asked him kind of what had happened in the last 5 years, he said, well, nothing as memorable as pulling that person out of the burning car. His daughter's a teacher. His son actually works in the correction center now. He has another son that's working in the Walmart distribution center here. He has 5 grandkids, and he's retiring on October the 1st. Brian, thank you so much for your 30 years of service to Tarrant County. Next is Ann Nguyen. She is on vacation and will not be able to be here today. Again, she said, I've absolutely loved, she works in information technology. She said, time has flown by. She was originally from the Houston area, came up here to go to TCU. When you see Ann, please thank her for her 30 years of service to Tarrant County. Thank all of y'all. Without you, Tarrant County wouldn't be near the place it is to serve and to be a part of. We've got some refreshments back in 504C. And 895, wait a minute, Tom. Wait a minute. Don't get a head start on us here. 895 years of service to the county. Thank each and every one of y'all. And I'd move that we receive and file the employee recognition.
Second.
We have a motion to second. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. That was a whooping.
You gonna do these next?
No. I'm gonna do a couple as they come out. Court members, you have before you the consent agenda.
Move approval. Second.
We have a motion second to approve the consent agenda. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Public hearings, do we want to go ahead and do the public hearing?
Yes.
Okay.
Good morning, Your Honor.
Good morning.
Members of the court. I'm here for any questions that may come up.
I would open the public hearing and ask if there's anyone here wishing to discuss the performance evaluation report for community development. There appearing to be none, then I'll close the public hearing. And does anyone have any discussion at this time? Do we need a motion?
Not today.
Okay, thank you.
Thank you.
Members of the court, we can now go to the briefing agenda. The first one we're going to take up is the hospital district's FY21 proposed budget presentation. Steve, do you know who to do something?
Okay, I don't have. Good morning.
Good morning.
Good morning, Steve.
So I'm Steve Montgomery. I'm Judge Whitley's appointee to the JPS Board of Managers.
Good, so when I ask you a bunch of questions, you won't.
I'm ready.
That doesn't save you, Steve.
So I want to thank you for the opportunity to be here today. I'm happy to introduce our FY22 budget and reflect on the work of your appointees have put into getting us where we are today and setting the course for where we want to go. Back up a little bit. Like most of you, have had a long relationship with JPS. With the upcoming 20th anniversary of our nation's tragic and dark day in 2001, we all remember exactly where we were when we heard the news of 9/11. Well, I was in a meeting at JPS, going over a board committee discussion. So over the last 20 years, I've had a very up-close and personal view of JPS, our growth, our challenges, and our triumphs. And this is one of the reasons I'm so proud to present this budget to you today. This budget reflects the commitment of your board and this administration to innovate and continue moving the organization forward in many ways, positive ways. It's based on a newly adopted strategic plan. It includes a new compensation initiative that seeks to address a living wage for our frontline and behind-the-scenes workers. It builds new structures around our connection program that seeks to to better educate ourselves and our patients, better access, improve care models, and ultimately improve health outcomes. And it assumes a debt issuance to begin fulfilling our promise to and expectations from our community. With that, I will hand the wheel over to Mr. Early to dive in a little bit more.
Thank you, Steve.
Thank you.
I will say that when you have a chair of finance like Steve Montgomery and you have 10 of the members of that board, it's pretty phenomenal. And it's pretty phenomenal to be the CEO of an organization like that with over 60 different meetings throughout the year. It's like painting the San Francisco Golden Gate Bridge. You get to one end, you get done painting it, and you start on the other end, and you paint the other end. Sharon will start in about 3 weeks working on next year's budget and her team, and it's pretty amazing what they do, but it's also amazing what board members do to put their time and talent into this. And I want to thank you as commissioners and you, Judge. I think when you see this live streaming and you see the presentation of a JPS budget, I don't think you understand what goes on in the meetings, the briefings that we provide you, the staff time that your staff provides to our budgets and coming to our meetings. This is just the culmination of it. There's a lot of work that goes into a budget. The one thing that I would say that Mr. Montgomery talked about is two areas of major concern, is not only looking at the living wage, but doing a market analysis of all of our current employees and making sure that we're paying fairly. And that means paying fairly based on a variety of circumstances, not only the work they do, but their gender. And any other potential obstacles that might come in the way that shouldn't be there. And Commissioner Allen brought that out in our briefing sessions, and that will be a key component of what we do when we look at the fairness of what people are paid at JPS. We compete in a really tough market, but you got to compete in that market, because if you don't, people go without care, and it's really critical. The other thing is, as Mr. Montgomery mentioned, we're going to pull $200 million down in our first level of debt from the bond. In there, you will have a commitment from me and the board that you will see groundbreaking of a medical home this year. The reason that medical home and some of our other initiatives are not enumerated in the budget is because we haven't gone through the board and we haven't gone through you for approval of those issues. We will do that, and we will do that in good time and in proper time. Broadus, our partner on this, is very, very supportive. They're working diligently to make sure that we continue to move forward. And as we move forward in breaking ground for that new medical home or multiple medical homes, we haven't seen any of the information that would indicate anything different than what the Blue Ribbon Committee came up with years ago, and the need to have 4 new medical homes throughout Tarrant County in what we do. And also our emphasis on behavioral and mental health. You can't put a component of healthcare together without the mental and behavioral health element to it. So I think it's a strong budget. I think it's a good budget. I'm proud of it. I'm proud of the team that worked on it, and thankful for you as commissioners giving it your time, your diligence, and your effort, and the briefings that we have with you. So what I'm going to do at this point is I'm going to turn it over to Sharon Clark. Sharon is our Chief Financial Officer. And I will tell you that Sharon is talented in a variety of ways, but we have budgets at JPS that meet the needs, but also we don't come back to you, and Sharon does not come back to the board and say, oops, we need more money. We made a big mistake. We need some assistance. She's tough, she's challenging, and she's the exact person you want as your Chief Financial Officer. I always tell people at JPS, don't get to know the CEO. CEO doesn't really make decisions. The 2 people in a healthcare organization that makes decisions are the CNO, because your chief nurse has 3,000 people behind her who face paint every day if you get in their way. And they're the toughest, strongest nurses you're ever going to see. Get to know your CNO and get to know your CFO, because they're the ones that tell you what you can and cannot spend. So with that, Judge, I'll have Sharon come up and go over some of the numbers with you.
Before you do that, Robert.
Yes, sir.
We have each received a briefing on the upcoming budget for the health network, and I, for one, am very pleased with the budget. I am especially pleased with the new human resources initiatives to pay employees a living wage, and there are are a number of things in that budget of which I am especially proud. But I don't think I can get to a discussion of that budget just yet. There's a 2,000-pound gorilla in the room, and that 2,000-pound gorilla is what we read about in the Star-Telegram last week. About billing issues at John Peter Smith and the loss of a lawsuit relating to that issue, the payment of dollars to the federal government in settlement of that lawsuit. I'd like for you to tell the court what you know about that.
Sure.
What you've done to make sure that the issues are fixed and will never be issues again going forward.
Sure.
And assure us that this is a situation in which we should now have confidence.
Yes, sir. I appreciate your comments. And anytime one looks at any mistakes that you made, any mistakes in an organization, you want to make sure that you fix them. And JPS quickly addressed the issue as fast as possible. Coding and billing is definitely a challenge, and those marks change often. We found that we had a software challenge that created some problems for us. We immediately fixed those. We immediately brought in third parties, both at the third-party legal level and third-party auditing level, to look at what we were doing. We addressed those quickly. The issue went to the Department of Justice. The Department of Justice at that time chose not to proceed on with that case at that time. We did make a settlement with the individual bringing the claims to JPS. That was provided to me by good legal advice, both independent and our own general counsel. Looking at the overall cost and what we would take the organization through, we did make a settlement on that. We were found not innocent or guilty of what we had done, just trying to figure out what we do to make sure that coding was right at JPS and that billing. There was no fraud included, and the federal government did not find fraud in that. And I told the federal government when I talked to them, I said, we have mistakes. We did not code properly, and we need to figure out how to code properly. The finance team and our board took quick action, and that's what we've done. We'll provide any and all information, as we will always with you all. We'll certainly with the press and others to make sure. As far as going forward, we have not only created new software, we've created new personnel in those areas, and we feel confident that you're not going to have that problem. It is certainly a large and cumbersome challenge, but it's one that we don't shy from, and we must do. So it wasn't a matter of taking money from the government. In fact, we were quick to pay the government even before any of those discussions took place. We wanted to make sure that
so
we were...
Like the paper indicated, you met with the government, you paid them even before they requested or that deal, and so you had taken care of that part of the deal.
Yes, sir. We took care of as much as we possibly could from our independent audits, and we told the government once we paid them, even before they asked, we would obviously look at whatever else they found or any other third party found in any particular payment.
And so you didn't lose a lawsuit.
No, sir.
You chose to settle.
Yes, sir.
The civil lawsuit as opposed to, and that's, I've had a little conversation with you about the fact that I'm not sure I wouldn't have pursued it and gone on through the process just because you're right, the coding is a very difficult thing. The software you've looked at, you've changed the software from that perspective. The employee that filed the complaint was the one that was over the compliance area that is where the problem was.
Yes, sir.
Okay.
I will tell you on a personal note, you always want to be better as an organization. You always want to do what's right. You always want to fix your problems. When they're brought to your attention as a county commissioner, when they're brought to your attention as you all have dealt with in the past, of any employee that sees anything that may be going wrong in your organization, you want to fix it. You really do. But it also hurts when you have any employee that says you're doing wrong and I'm frustrated. It just is. It's a challenging situation. You want to do what's right at all times, and I think that's where JPS has done right. We admitted what the challenge was. We did everything we possibly could do with third party. This wasn't investigated by JPS and its team. It was investigated by third parties before anything on this took place. So I genuinely appreciate your concern. I think if you didn't appreciate your concern, you wouldn't be running the organization you should be running. So I think we have good employees. I think we have people that want to do right. And I'll try to do everything I can possibly do as a CEO in the organization to make sure that these challenges don't come up. And it is hard. It's really hard. You all have faced them at the county. You've faced them at the sheriff's office. Faced them even with press entities of what you do when you settle a case or you don't settle a case. And it is hard and it is challenging. And I understand, Judge, your opinion that maybe we should have pursued this even further, but it is definitely challenging. So,
well, I think the things that you have just laid out needed to be said publicly.
Yes, sir.
I'm satisfied, and I trust that the situation is fixed and will never happen again.
Yes, sir. I appreciate it. And the thing that is interesting about
I want to just, I appreciate very much what you're saying there. But before I came into this position, having worked a lot with medical offices, coding is a very difficult and complicated process. And you know, it's very difficult. As the editorial said, this is a problem that everybody faces, and it's real easy to go back and second guess with hindsight.
Sure.
But I think that, you know, everybody is always worried about the coding and if you're properly coding it or you're not properly coding it. And in a public hospital, you know, I think that, and you know, we haven't actually talked about this, but a lot of that coding deals with the complexity of the individual who's standing in front of you as a patient. Mm-hmm. And in the public hospital, those patients often have many problems other than just the one that they happen to have at that particular point in time. And the complexity coding and that little modifier that you put on there is oftentimes very difficult to know when to and when not to. And that's why you have a compliance department that hopefully is looking at that and is following up to determine whether or not it's being coded properly.
Here's the one thing I would say, and I appreciate that. I appreciate your comments and appreciate where you've been as a CPA and dealing with coding issues in your prior life. And I appreciate your concerns and comments y'all would make. Here's the interesting place that is JPS, that I accept every day and I'm honored to do it, is when you make a mistake, in my opinion, you admit the mistake, you fix the mistake, and you move on. You don't hide the mistake. You don't pretend the mistake doesn't exist, because in a complex organization like that, you will make mistakes. When they first interviewed me for this job, they said, "Why should we hire you?" And I said, "Because I'll make mistakes. Judge me for how I fix them, not the fact that I'm going to make them," because I think that's honest. The other thing about JPS that's interesting is at the same time, if you have challenges and problems, you fix them. At the same time, you have everything that's coming through your front door, from your trauma to your COVID, to everything that is what healthcare see right now. It was like in the 30-year anniversary from the Department of Health, Dan, I believe, and the most challenging he's been through in the last 18 months, and having people get pre-tested and then ultimately so they can go visit somebody who's dying. It's been the most difficult 18 months I think any healthcare worker has ever gone through. And it's tinged with challenges and problems. So at the same time, any mistake, you fix it. The challenges coming in your front door, you deal with them. A pandemic, you deal with it. And everybody at JPS and Baylor and THR and HCA and Methodist Mansfield are fatigued. And it's really, really challenging, the fact that you have political answers, and yet over 90% of the folks in our ICU are unvaccinated people. It's not a statistic that is debatable. It's true. Every time somebody comes in on the high level of 90%, we see that. So this challenge and this problem will be dealt with, as well as everybody coming through the front door. JPS won't miss a beat. And thank you very much. I appreciate it.
Thank you, Robert.
You bet.
There, go ahead.
First, I want to thank you for your time. We've had some pre-discussion individually. We do spend a lot of time on this budget, and I think it has some really great initiatives that are built in this year. Do I have just use it? Am I up? Okay. Oh dear, it's on the side. Okay, I'll be looking down a little bit. I apologize. So we wanted to present today a budget combined. It's at $65.5 million for our fiscal year 22. Just as a reminder, our year end is 9/30. One of the things that drives the budget on the hospital setting is volumes. We have not assumed that we are going to have large increases. All of our areas have slight increases. Outpatient does have larger ones than the inpatient areas. One important thing we have assumed, which with the last month probably incorrectly, that our overall acuity levels will be declining. We don't know if that's true or not, but that was an assumption in our budget. So we have several revenue sources to make up 80% of my budget. We have property taxes, that's just over $500 million this year. And then we have patient service revenue, and that represents collections from Medicare, Medicaid, commercial insurance. We do have a large retail pharmacy that comprises a little over 5%, and supplemental funding that comes through the state for Medicaid is about 15% of this budget. So our ad valorem tax, as I mentioned earlier, this is based on the certified tax rolls. So just under $504 million, with no proposed change in our tax rate. Supplemental Medicaid funding is one of the hardest things to pin down right now. There are a lot of changes going on at the state with discussions between HHSC and CMS. What we have done is to make sure that this budget reflects our latest information. One big change this year is legislatively, our DSRIP program ends. So effective in this budget, we lost about $39 million that we were receiving through those DSRIP programs. What the state proposed to replace that is programs that we call CHIRP and TIPS. We would only pick up about $20 million from that. It doesn't show up on this graph because it gets paid per claim, and we included that in the net patient service revenue. But again, it's very fluid at the moment right now as the state tries to understand exactly how these programs are going to move forward. The biggest area of expense Robert alluded to is our people. If you include salary and benefits, that's over $610 million for about 6,200 FTEs. So we're close to 7,000 employees at the moment. That makes up about 52% of our budget. The next largest category is going to be professional fees that are paid to physicians to see our patients. So, and then of course we have medical supplies and purchase service. Interestingly, our purchase service, most of that goes to support our electronic medical record. Our capital budget this year was set at $37.6 million. Most of that is going to patient care, as well as our current facilities and construction projects that are outside of the bond monies that Robert mentioned earlier. So this is our combined budget once again. It's going to be $65.5 million. This includes both the medical center that I've covered. Our acclaimed physician group is budgeting 484 providers this year. That's an increase of about 33 FTEs. And if you have any questions about the budget, I will be happy to answer them.
Only comment, Mr. Finance Chair, is that last year you ended up doing very well. I know that in talking in our meeting we had, I think y'all are planning on putting $10 million more over into that restricted area. When we passed the bonds, there was about a $400 million cash need to supplement what the program was. Inflation, increase in construction costs. Last year, y'all made about I think you ended up with revenues in excess of expenses of about 250. I'd like to see about 200 instead of 10 moved over to that particular area. I've asked for days of expenses, how much cash you have as far as days of expenses in comparison with other public hospitals, but as I recall, the last time we looked at that, y'all were way over what the other ones had, and I would like to see us cover that 400, whatever, plus whatever, we determine may be needed now because of the increase in construction costs pretty rapidly. The board restricts it, the board can unrestrict it, but I would really like to see, I think y'all have got about 200 in there right now, as I recall. If you put another 200 in there, that would at least get you up to the original 400 plus some, hopefully into the future. And when you come back and talk with us about the number of days, of cash expenses that you've got, maybe the board could also recommend that. And I'd also like to see the list of capital projects to the court as far as the bond issue money goes that you expect to look at over this next 12-month period of time.
Thank you.
Thank you.
Thank you, Sheriff.
Good job.
Okay, we can now go to another briefing item. We're going to ask Mr. Tenasia to come up and start his presentation as relates to emerging health issues.
Well, good morning, Your Honor, members of the court.
Morning, Vinny.
So we're waiting for the slides to come up, but the news is not good. Unfortunately, we're still adding a lot of cases. This morning, we reported numbers that we would typically report on the weekend on Saturday. So we have 1,700 plus cases being reported, and I think additional 27 deaths. So the weekend numbers are going to be reported tomorrow as we catch up from the holiday. So overall, the trend still remains up, and once I get the slides going, I'll show you that the hospitalizations are still increasing. With the holiday weekend, there was some decline in reporting from the hospitals. Even with that, we have quite high numbers. I think we're approaching 1,100 something was the number, if I recall correctly, people confirmed with COVID in the hospital. Over the weekend, I looked at the report, there were about 1,200. So we're in that 27%, I think, the overall hospital capacity consumed with COVID within Tarrant County. And here's the slides back. Oops, went too far. Yes, so we have 27.07% of hospital capacity in Tarrant County consumed with COVID. And I think about 52% of our adult ICUs have COVID only. That's the biggest burden. Trauma Service Area E, 23.23%. That's 3,639 people confirmed with COVID in the hospital. And as Mr. Early said, actually I was driving on the highway last night, big billboard on the highway. Baylor, I think, has done some work on that. 92% of the people in the hospital with confirmed COVID are not vaccinated. So the message remains the same. Vaccines available. Let's get vaccinated. If you're going to be out and about, wear a mask while this surge is on and avoid unnecessary large crowds.
In Trauma Service Area E, how many days have we been in excess of 15%?
I'd have to go back and look, but we're approaching over 2.5 weeks. I think August 8th. I'd have to go look at the date, but somewhere in that time frame, so maybe 3 weeks, we've been above that mark. Yes, sir. Trends in Tarrant County. Again, the chart on the left shows our epidemic curve. As you can see, the cases are continuing to surge. And the chart on the right is starting to show you the death numbers increasing. Death data is a lagging indicator, but certainly we're adding to our tolls every day. I mean, I used to be able to report 2 deaths, 3 deaths. Now we're talking in the 20s. That's kind of become the norm. So those numbers are adding up. And on that note, I want to kind of give you some national statistics. So overall, we've reached about 40 million cases in the U.S. That's a lot. But the headline that grabbed my attention is we're currently approaching 650,000 deaths. I think 649,000 was the number that I recall. The biggest pandemic we've had on recorded history was the 1918 Spanish flu. 675,000 recorded U.S. deaths. We're a hair shy of that. I mean, at the rate we're going, it could be this month that we surpass this number. And currently, I don't really see any difference in our approach to the pandemic. So we really need to rethink our strategy and slow this thing down. And a lot of those things that we talked about, the public health measures, wearing of masks, getting vaccinated, avoiding large crowds, they work. I mean, the data shows it. All of this stuff that you saw, the flatlining of the curve, people were doing those things. And now that we're not, we're seeing a surge again. So here's just, again, local data, for your consideration. The positivity rate has sort of flatlined over the last few weeks. Now, there's good news in there that it's flatlined. Bad news is it's flatlined at a very high level. We're at 21% positivity rate. The chart on the bottom left is just striking. I mean, look at the surge in hospitalizations in the Trauma Service Area E. There's no other way to put it other than adjective. It's a rocket ship. And that is putting a burden on our healthcare system like no other. There's all kinds of issues behind that. I mean, it's staff fatigue, people leaving their jobs, not enough people to man the hospital beds, pediatric beds being full. I mean, you all have heard those stories. So a lot of that is putting a lot of pressure on our community. Other healthcare needs are starting to suffer, and that's a national trend. That's just not here locally. In other places that are experiencing the surge, same kind of things are happening. So talking about national trends, as you can see, a couple of weeks ago, the Delta surge was concentrated in southern United States, and now pretty much the entire country is engulfed minus a few handful of states. Again, measures have to be put into place to kind of break this trend, but there we are with a full grip of the pandemic back for the United States.
Is Nebraska just not reporting, or is it just more corn than...
Oh, probably not. It's probably a reporting glitch happened. Yes, sir. I brought in a Texas trend map. We haven't seen this in a while, but it was just very striking to see that from a hospitalization standpoint, we're pretty much where we were at January. We're a hair shy. I think we had 14,100 as the peak in hospitalization, and we're at 13,500 something. And I think I looked at it, it peaked at 13,900. It got very close to that January number, but we're there. So that's the Texas picture. And again, you've heard the message. Let's get these things done. So quick update on vaccines. So our numbers are definitely slowly improving. As you can see, we've got 2.3 million doses administered all across Tarrant County. 54% of the eligible population above 12 and older, they're vaccinated, fully vaccinated, and about 44% of the total county's population is fully vaccinated. So more work to be done, but it needs cooperation from everybody. People need to kind of look at the data, get the facts, arm yourself with the facts, and then make a wise choice. And our advice would be, data is very clear. Let's get vaccinated and get this thing behind us, because it's really causing all kinds of issues.
I would like for us next week, I talked with some people from Harris County. They're offering incentives now. I would like for us to set aside some time to talk about some sort of an incentive program. I've stated previously that I would like to do it, but that I don't want to reward procrastination. But I'm to the point now to where, since the governor will not allow us to do anything else, that maybe we could look at some sort of an incentive program, because Harris County is saying that it's been very successful there, and they're continuing it, and plan, they keep adding to the amount, but I'd like for us to look at it, because we need to do something. And if, again, the governor will not allow us to do anything with masks. They will not allow us to do anything with vaccinations. So let's see if maybe we can incentivize.
So, Your Honor, are you speaking for county employees or for general population?
Yes, both.
Yes, sir. All right, so quick update on the demographics. Again, slow improvements in all categories, but I want to keep bringing your attention to the younger age groups. And this is our appeal to the parents. These kids can't decide for themselves to go get vaccinated, but as parents, please protect them, because you just have to look at what's happening in the schools and what's happening in the hospitals. Pediatric population is the prime target right now with the Delta surge. They're getting a lot of cases happening. Yes, they're young and resilient, but why risk that? There are ones that are having issues, long-term impacts, and they're missing school because they're out sick in the hospital. So certainly, let's protect these kids. Educate your child on how to properly wear a mask. Mandate or no mandate, you can teach your child that this is currently the right thing to do and protect yourself and others from COVID. So that is my appeal to our parents in the community. Protect these young kids, because that's where the burden of the illness is right now. So vaccination efforts continue, and I sort of redid some of these slides. There's now almost 30 publicly supported sites that are operating in Tarrant County on a very regular schedules. So all the information is at tarrantcounty.com/vaccine finder. We have our public health clinics, obviously. Our regular brick and mortar clinics are open. And we have some regularly scheduled pop-up locations that have been doing real well. Le Grand Plaza, Sundance Square, you all heard those before. They're doing great. But there's now an additional support coming to us from a variety of community partners. Fort Worth has quite a few locations going as well. But TCC announced that as their campuses reopen, they're putting together 5 vaccine sites and 5 testing sites. So the vaccine sites are here Monday through Thursday at 10 a.m. to 7 p.m. And their start dates are a little staggered. I think the one I visited last week was at TCC South. So if anybody's interested, it's a big campus. It's the SSTU building, and the room is 1112. Easy to find. If you get on the campus, then you'll know where it is. And there's bus service right outside. I was very impressed. I mean, it's for their students, but even if you're going there for a vaccine, you can get right outside of the building, and they'll stop you there, and then you can go in and get vaccinated. So that's a great addition. And in addition to that, we have over 150 pharmacies that currently have vaccine in stock, and several private doctors and providers providing vaccinations as well. So there's not a dearth of opportunity to get vaccinated. Certainly a lot of choices, and people can go at various times and so forth. And a quick wrap up of our back to school events last month. In 4 weeks, public health in partnership with the Tarrant County Immunization Collaboration We vaccinated over 9,000 people. Over 20,000 doses of vaccines were administered in the short 4-week period. 16,000 of those were non-COVID related. They were the back-to-school shots that are required every year. And about 3,600 COVID vaccines altogether were administered through our efforts here. So a lot of work is being done, and it's not all just COVID. There's other things that do impact our community as well. So here's our pop-up clinic schedule. As you can see, kind of ebbs and flows. It's kind of on demand. When the community requests pop-up locations, we go take care of that. And this is just ours. MedStar's helping, Footworth's helping, Arlington's helping, and many other partners have jumped in. So there's a lot of different other entities helping us do this work in our community. So the need has shifted again to mobile testing operations. As you all heard, that we had launched a mobile effort about six weeks ago, and it's kind of run its course. The capacity of those mobile teams is getting exceeded, but we have 6 locations going. I think Fort Worth's got about 8 or 9 locations going. They've actually made one of their locations on Decatur Avenue, the Tex Rail station, a 5-day location, so Monday through Friday, 8 to 5. But y'all passed a contract last time we met. So we have a vendor now that can kind of help us launch some of those bigger sites that can handle bigger volumes. We're currently scheduled to have 2 sites come up by the end of this week. Originally, we were going to target a midweek launch, but then TCC announced that they have sites going up as well. So we're trying to not overlap, but complement each other. So we'll have 2 sites going, one at the Resource Connection and one at the Northeast Annex on Brown Trail. And those will be Friday through Sunday locations. So Friday, 7 a.m. to 5 p.m., and Saturday and Sunday, 9 a.m. to 4. These are very flexible. If the demand is there, we can add days, take away days, change days. So we can certainly adjust that. But we wanted to kind of get this started and not open multiple sites, because TCC, one of the sites is launching this Wednesday at the South Campus. So we wanted to make sure that there's enough cooperation and coordination that we're not overlapping and the sites are right close to each other. So again, TCC's launching 5 at each of their campus with staggered start dates. First one launching this Wednesday, and those will be Monday through Thursday, 10 a.m. to 7 p.m. The difference is all their vaccine sites are going to be indoor sites, and all their testing sites are going to be outdoor sites. So we'll coordinate that and make sure that we're not overlapping too much on their schedule. And then other community partners are jumping in as well. UTA has a site that's going public currently on Wednesday the 8th also. They have had the site up and running for their staff and faculty, but as that testing effort sort of fades away, now they're opening it to the public, and it will be open 7 days a week, Monday through Sunday. I think it's 8 to 5 is their timing. So a lot of different options coming into play here over the next week or so. Any questions on any of that? I know there's a lot of moving parts on that.
Yeah, Vinny, I had a question about the turnaround time for testing. I'm hearing that folks are being told it's 24 to 48 hours, but it's actually longer. So can you just lay out for me what's the expectation for the testing results? It
varies, because let me address what public health does. So at the site, we recommend wait up to 72 hours. But we have an in-the-house lab. What we're trying to do is turn it around the same day if we get the samples in time. The latest I've seen is the next day. So it's under promise, over deliver is what we're trying to do. So set the expectation that it may take up to 72 hours, because things happen. Lab gets backed up. They have to rerun the samples. West Nile samples come in. Other things come in. So. And that's generally what I've heard from a lot of the vendors. They're all setting a 72-hour timeline expectation. Most are trying to turn around within 24 to 48 hours.
So what about the work that we're contracting to do with the BioQ? What is their turnaround time?
So expectation is, again, 72 hours. That's what they're going to say. They have a mobile app you can sign up on. So if you do that, certainly the results will come in on that mobile app. They also have a calling team that calls. But as you can imagine, those will take longer. But if you have the ability to sign up on the website and get your own account created, the results will come right in. Again, the promise that they told us is that 72 hours. But, I've talked to their vendor quite a few times. They're local labs in Houston. So they said usually they try to turn around the next day.
Thank you.
Any other? Yes, sir.
Benny, do you have that our site in Precinct 3 is changing?
Yes, sir. So we had a site running at your sub-courthouse, and as you can imagine, the traffic volume was getting quite a bit. So we're actually relocating that to the athletics complex. I forget the name.
Next to the Hearst
Yes,
Fire
sir.
Station.
Yes, sir. It's on Precinct Line Road. Yes, Hearst Fire Station 1, but there's an athletics complex. I forget the name of the facility.
It's the Hearst Athletic
Yes, sir.
Complex, right around the corner, kind of not far from the courthouse.
Yes, sir. So it will be Mondays there, same time, 8 to noon. But what we're going to do is start to sort of look at everything that's happening. Once the TCC site goes up live, it will be literally right across from there. So we might want to start peeling some of those mobile sites off, especially the ones that are outdoors. Redeploy those staff to other operations, some of that are indoors, and of course they have other things that are happening in their clinics as well. That was kind of the design, that if there's mobile testing need, we'll have the people there. But as these big supported sites, vendor-supported sites come up, then we might peel back the mobile operations and let people go to those bigger sites, because they're designed to handle volume. Our little mobile sites are not designed for volume, and that was causing some backups with traffic and all those types of things. But on Monday the 13th, I believe, we will be at the Hearst Athletic Center with our mobile testing operation. That will be our replacement for the Northeast sub-courthouse location. So here's a quick rundown of all the numbers. As you can see, quickly exceeding our capacities there. The 6 locations we were running started off first week with just a couple hundred samples, and 5 weeks later we're at almost 1,200 samples. And then this is what you see on the mobile testing. In the back, we're also working with homeless shelters and other facilities that have outbreaks. So all of that does come into the lab as well. I just didn't put those numbers here on the slide. That's all I have. Be happy to answer any questions.
Thank you, Vinny.
Thank you, Henry.
We have a couple of audience participations on the COVID-related matters, so I'm going to go ahead and call those now. First is Kara Garcia. Kara, this is Judge Whitley. We're at the point in time.
Hello?
Excuse me. This is Judge Whitley. We're at the point in time on our agenda for audience participation, and you'd indicated you wish to speak regarding COVID. You have 3 minutes. Are you there? Are you there? We will try her back because I was. Marcella?
Yes.
This is Judge Whitley. We're at the audience participation time frame for COVID-19. You have 3 minutes to make any comments you wish to make at this time.
Yes. Good morning. My name is Marisela Aramino, and I'm a resident of Precinct 2 in Mansfield. I'm pressed for time, just like I know you all are, so I'll keep it short and simple. But first, I'd like to share my absolutely do everything in love. 1 Corinthians. Second, I ask, brother, demand that you implement a mask mandate, and I demand that you ask our local school districts to implement more better COVID-19 health and safety protocols. Third, I feel terrible for asking this of our amazing Tarrant County public health staff that are so overworked, but we need more COVID-19 testing sites across the county with longer hours. I did just hear the update that Mr. Taneja gave, so I really, really appreciate it. Frederick Douglass said, power concedes nothing without a demand. It never did and it never will. So I and many others demand you do right by our community during this public health crisis, for our exhausted medical staff and for our kids. Mil gracias. Tenga buen día y que Dios nos bendiga.
Thank you very much.
Thank you.
Please leave your message for
Carey Garcia.
Okay.
She don't want to talk to you, Judge.
I messed up the first time, and I don't know if that's the reason she wasn't answering from that point forward. But anyway, the rest of these are on other items, and so we'll get to them as we proceed through the agenda. Mr. Manius.
Thank you, Your Honor. Members of the court, we can now go to the administrator section. We'll begin. The first one deals with the coronavirus. We've included a summary report to the court members, and what we ask on this is that you simply receive and file that report at this time.
Move to receive and file.
Second.
We have a motion to second. Any discussion?
Yeah, I do have a question. I know earlier at the start of the meeting, you had mentioned in the claims that we weren't able to move with some of the rental assistance program payments because they needed to be reconciled.
Yes, ma'am.
So what does that mean for those applicants, whether it be the landlord or the renter, and then receiving the payment?
As soon as we receive a verification, if there are any duplicates, we will not make those payments. But those that aren't a duplicate, then we'll go ahead and exercise and the auditor will go ahead and release those funds.
Sure. And you shared that earlier, but how many people are we talking about are potentially affected?
I have no idea.
I don't have an exact number. It is a fairly large check run because the court didn't meet last week, so it's a 2-week period. Again, we were promised the corrected file by yesterday, which we didn't receive. My understanding, the email that was received today is that they hope to have the correction and be able to push the file out to us today. It will take us at least a half a day or slightly longer to match the checks to the file, and then we would propose releasing those. So again, when you approve claims, you need to approve those payments. You just needed to understand that I can't release them without being able to check them to the duplicate database.
Sure.
Since the state set it up the way they did, and we do have instances where people have applied at both locations.
Yeah.
Can we take action to give the auditor the authority to release those checks after she goes through the dedupe process without having to come back before this court?
They're actually on the claims today, so that whenever you approve the claims today, you're authorizing the auditor to release those funds.
I just wanted to make sure the court was aware of the fact that we were not going to be able to send those out as we normally would as soon as you approve claims today.
Sure.
If we don't have that file.
Sure. Well, and that's part of my concern is the just amount of effort that's gone into us building up the program and trying to solidify good relationships with all of the stakeholders. So are these folks going to be notified? I mean, I don't know, maybe they wouldn't have been aware of any type of delay, but if there is going to be a delay and that's a change in the expectation, then we need to make sure we're communicating that.
So let us do this. As soon as we get the file and do the cross-checking with the file, we will notify you all right away. If there's an extended delay, I mean, if we don't do it this week, well, then we'll bring that, we'll make an effort to contact those individuals. It's going to take, as Renee said, there's a lot of them, sure. And we may have email addresses and things like that, but we'll go ahead and put our team on it also to make sure that they're notified. But they won't be notified if you get that deal today and we release them tomorrow. Okay. If that's okay with you?
It is.
Okay.
Any other discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
So members of the court, on item 2 and 3, these are items that we're required to ask you to take certain action. Remember that next week we're going to be approving budgets and the official tax rate, but we're going to go through 2 issues now, one for the county and one for the hospital district. On item number 2, we're requesting that the court take the following action: to receive and file the proposed no new revenue and voter approval tax rates in Tarrant County as listed in your court communication. Propose a tax rate of 0.229 per $100 valuation for tax year 21 and take a record vote. And if the proposed tax rate exceeds the no new revenue or voter approved tax rates, whichever is lower, call a public hearing for September 14th, 2021 at 10 a.m. in the Commissioner's courtroom. I will tell you that the proposed tax rate that we are proposing for Tarrant County does not exceed the no new revenue rate nor the voter approved rate.
So you're asking that we receive and file?
Actually, we're asking for you to, that's not a receive and file, but that is to go ahead and take those particular actions which I just recommended.
You mentioned receiving and filing.
That was on the previous one, I think.
It was on
This is on the proposed tax rate.
Item, that was on item number 1.
Thought he said it too. So, okay. So what is our action? What is the request for us to?
So the request is that you receive and file the proposed.
So you just said receive and file.
Okay, so here's the deal. There's several actions we need to take.
What we're doing is we're adopting the proposed tax rate of 2.2 or 2.229.
There's several items that we need to do. Let's take them in order then. We are going to ask that you receive and file the proposed no new revenue and voter approved tax rates for Tarrant County as included in your court communication.
Move to receive and file.
Second.
We have a motion and second. We have an audience participation on this particular item. So at this time, I'll ask Thomas Polinkasi to come forward.
Thank you, Judge Whitley, Commissioners. I wanted to approach you today to ask you to be mindful that unlike your Commissioners Court, there is one governmental entity in Tarrant County that is raising the tax rate 7 percentiles. I think the state cap is 8 percentiles. It looks like, based on your numbers, that you're actually cutting the tax rate, even though we know we're all property tax owners and all of our property taxes are going up because
you are cutting the tax rate.
Yes, sir, the rate. But our appraisal and our market values have gone up on average 20%. That's on all of us. The point that I wanted to make is consider cutting the tax rate even more on one specific line item or two. The county is already in pretty deep with TRWD and TRVA. As we're starting to discover, and you'll hear more about later, the amount of scandal and fraud, not miscoding of invoices, is now in the hundreds of thousands of dollars. when you find out a little bit more about a number of conservatives and liberals and progressives and moderates that are diving deep into this. And since the county has specific accountability, since it has board members on the TRVA, this is not just a few small contractors that maybe clipped an extra couple grand. So far, I have 120 invoices that indicate an average of $2,400 in fraud each on average. You start to scratch your head and wonder how those 3 overpasses that 10 years from now will be bridges. You realize that there's $14 million missing right there. And the TRWD is asking for a 7% increase with all the other scandal, the $300,000 up in the air, the $60,000 up in the air. We started diving in and checking out with open public records the numbers of accounts and wrongdoing that's taking place. The irony here is that there's probably conspiracy and racketeering going on, not just with the amount of nepotism in the organization among its 350 employees, but there are already county dollars in this fight, I understand. And no doubt this budget has more millions to hand over. I don't know how you stop that part of it. I don't know how you suspend it until there's an audit, a forensic audit. My understanding is that your accounting firm did do an audit recently, but I doubt it was a forensic audit. And I'm going to tell you, I'm a little Aggie and I have a management degree, not an accounting degree. But it didn't take me very long to look at a few of those invoices and realize that sometimes as much as $17,000 in work didn't happen down there at the TRVA office. And that you don't carpet the boardroom or conference room with 49 square yards of carpet when the room is only 16 square yards. That's just an example. I'm not exaggerating when I say that as we pull more invoices from a number of small contractors that have buddy deals there, that this is scandalous on a level that the county hasn't paid attention to in the past. I believe that the new board president is being snookered, literally, because of the staff protecting their own little kingdoms and dominions. And during general comment later, I'll be happy to give you a little bit better picture on what's going on there. I really appreciate that what you did do today, Judge, is you honored the Open Public Meetings Law, which is 551.007, which allows the public to come forward and speak during a particular agenda item. That's been squashed and suppressed at TRWD, and you'll learn more about that too. The point being is that I and other people connected with the citizens investigation have hundreds of pages of data on what's gone on in the last 7 to 10 years at TRWD. And if you have a question or you want feedback or information later, we'll be happy to share it with you.
I will say one thing. You made a comment about my firm. I have not been a partner or had any ownership in that firm for the last over a decade.
That's encouraging.
And I don't know exactly what work they did, but I don't believe it was with regards to an auditing of a particular set of financial statements. And again, we can't have any impact on their particular tax rate. I'm talking about the water. You seem to be going back and forth.
No, sir. I'm commenting on your.
You finished your statement. I'm making a statement.
All right.
You go back and forth between the water board and the vision, the Trinity River vision. They're two different, although they are, but they're two different groups. So be careful about mixing those two things together. And then the last thing I'll say is that yours may have gone up 20%, but the average residential increase in Tarrant County, I believe, was somewhere in the neighborhood of maybe 6.5%. So be thankful that your home went up 20, but not everybody's did that. And if you look at the appraisal district, the residential appraisals went up, I guess the total, wasn't it, Mr. Manius? Yes. Was about 6.5%. So thank you very much for your comment, and I know you've got another comment that we'll talk to in a little bit. Thank you, Mr. for being here today. We have a motion and a second on the floor. Any further discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
As it still relates to item number 2, we're requesting that the Commissioners Court approve or adopt a proposed tax rate of .229 per $100 value for tax year 2021 and take a record vote.
Move approval.
Second.
We have a motion and a second. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
There's not going to be a need for that third bullet since our rate is below the no new revenue and the voter approved tax rate. If we could go to item number 3 on the agenda, this is the same action, but we're asking it as relates to the hospital district. So the no new revenue rate is .225244. The voter approved rate is 243475. And the proposed tax rate is .224429. This is below both the no new revenue rate and also the voter approved tax rate. So our requested action is that you receive and file the proposed no new revenue and voter approved tax rates for the Tarrant County Hospital District.
So moved.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
And second item as it relates to that particular court action, we're requesting that the court take a record vote on a proposed tax rate of .224429 per $100 valuation for tax year 2021 for the hospital district.
So moved.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
We can move to item number 4 under the administrator section. This is an approval of participation in the City of Keller Tax Increment Finance District number 2. Ms. South is here to address the court at this time.
Good afternoon. Oops. Okay. So in July of this year, the City of Keller made a presentation regarding the establishment of a 795-acre tax increment financing reinvestment zone, which is up on your screen. It's across Highway 377 commercial corridor, and it was established to create a dedicated funding mechanism for the redevelopment and development along the Highway 377 commercial corridor, renovate public infrastructure throughout the TERS, and create a catalyst for economic development potential throughout Old Town Keller. So this TERS is a little bit different. As you can see on the screen, the projects are split into Tier 1 and Tier 2 projects. And the county will be participating in only the Tier 1 projects, which will eventually provide over $121 million in roadway, drainage, water, sewer, and other infrastructure improvements within the zone. And as set out in the participation agreement, the City of Keller is contributing 50% of their incremental tax revenues to the zone, which is estimated to total just over $25 million. And the agreement before you today provides for county participation in only Tier 1 projects at 50% up to a maximum of just over $14.9 million over the 30-year life of the zone. So the hospital district is not being asked to participate in this TERS, but they will be seeking participation by the college district. And so today we are seeking approval of the resolution and the participation agreement.
I move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes 4. Just note that Commissioner Allen is not a part of this conversation.
Thank you.
We're going to take a short break, 5 minutes.
We have one item we're asking the court to consider this morning, and that is to release the approximately $15,945,000 of collateral and accept the substitution of the $7,261,000 as outlined in your court communique.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
I think that was a yes. Commissioner
Yes.
Johnson? Yeah, he's saying yes. Show that vote 4-0 with Commissioner Fickus. Out. Ms. Glenn?
Move to receive and file personnel agenda.
Second.
We have a motion and a second, receive and file personnel agenda. Please vote. Commissioner Johnson?
Yes.
You're on mute, JD.
Not according to my lady here.
Can't hear you. But we know you're voting with us. Motion passes unanimously again 4-0.
Thank you. We have several items for the court this afternoon. We're going to tag team this, so I'm going to do the next two items. So item number 2, we're asking the court to approve changes to the table of organization for the Criminal District Attorney's Office. As described in your court communique, Ms. Wilson has a twofold request. She's asking for the creation of an Attorney 5 career path position that would be effective September 8th. This individual would be responsible for prosecuting and defending auto theft cases. The second part of her request is for a reclass. The reclass would result in a case management position being created effective, the reclass would be effective 10/1. This individual would manage specialty programs in the Criminal District Attorney's Office. As described in your communique, the Attorney 5's position would be funded by Auto Task Force grant funds in the amount of $151,970 and some change. And the reclass would result in money from the general fund of approximately $9,300 and some change. So those are the requests from Ms. Wilson.
Let me ask just a couple of questions before we maybe get a motion. Have we talked about these in closed?
The reclass, yes.
The reclass, yes. Did that go, and did we decide not to go to job evaluation, or has it been to job evaluation?
It hasn't been because that job description already exists.
Okay, so it already exists. And is this in the budget that we're going to be looking at next week?
The grant funds are not, because that's a grant.
It's all grants.
The reclass isn't, but is. So they had requested a new position that was a grade 18.
But that's going to be a grant position.
Separate from that. So they had requested in the budget a position that was a grade 18 position. Instead, they're getting a grade 17 position and reclassifying this one. So this particular position isn't in the budget, but the funds should be.
Okay. All right.
Move approval.
Second. We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
He's back with us. Motion passes unanimously.
So the next item is item 3. Here we're asking for changes to the table of organization for 3 departments, facilities management, public health, and purchasing. And as described in your communique, facilities is requesting 1 position, which is the senior projects manager. Public health, 4 position, 1 business manager, 2 financial analysts, and 1 administrative assistant, 2. Purchasing is requesting 2 senior buyers. All positions, if approved by the court, will be effective September 8th. The impact to ARPA funds would be approximately $695,863 and some change. And just recall, with these ARPA-funded positions, these positions exist only as long as the funding exists. There is no commitment to anything other than ARPA funding for these positions.
And I want to inject into this. I've sat in on some of the meetings with ARPA. Again, I think the folks are doing a great job of determining whether the things are ARPA eligible or not. But I will tell you that a light went off in the last one, and I made I said, okay, how much have we actually committed at the Commissioners Court level of our ARPA funds as a result of some of these things that we're doing? And we had the initial response, and I think they're still doing some refining of that, and that also included some capital stuff. But of the 408, we had obligated 92 million, which was a lot bigger number than what I had anticipated at that point in time. And so what I've asked them to do, and I don't know that we want to delay this for any of that, but I've asked for us to kind of get an update, because what I hope that we will not do is that if we're doing something that we would usually do as a result, and this more in the way of capital items, that we would normally do as a court in our regular maintenance and operations, that we don't use ARPA funds for that, but instead keep those ARPA funds for what I hope, we've talked a little bit about, and we've had a meeting about the possibility of looking to make differences like the mental health jail diversion and those types of things. And so and again, I've asked for them to come to us and give us a report on how much money we've obligated, and every time we obligate more of our ARPA funds, I'd like an update that kind of says cumulative total. Because I think, if I'd asked any of us how much money we had obligated to this point in time, I don't think anybody might have guessed as much as almost 25%. So this, you said 600 and something thousand, but is that a 1 year, or is that for the 4 years or through December 31st of 2024?
I think
you're going to turn around and look at it.
Yeah, that's typically just a 1 year estimate.
So this would be it could be as much as 2.8 million or more, just with these positions today?
If they ran the entire 4 years, yes. These positions here, and Judge, you referred to these here are simply to allow us to continue to manage and implement the ARPA, the various programs.
And I do understand that, but again, I think we have, and again, some of that's capital, but we had obligated 92 million, and I would think, or we hadn't obligated, we had authorized. That may be a better word to use. But we had said it was okay to go ahead and begin looking at that level. And so I would I don't have a problem going forth with this today, but I would really like for us to have a pretty detailed workshop pretty quickly on exactly where we are in the overall spending of the funds.
We'll make sure that happens.
So do I have a motion and a second?
I move approval.
I'll second.
We have a motion and a second. Any further discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you. So item 4, Ms. Worthy will step forward and she'll be handling that item.
Good afternoon.
I'm here to present to you the approval of the quarantine and isolation policy. During the 87th Texas Legislature under House Bill 2073, it was amending Chapter 180 of the Texas Local Government Code that grants quarantine and isolation leave. Well, actually, the bill requires that we have a policy. And so we have developed a policy, and this is paid quarantine leave for peace officers, detention officers, and emergency medical technicians who are quarantined or isolated as a result of possible or known exposure to a communicable disease while they are on duty. So this is not just specific to COVID, it's anything that is deemed a communicable disease. We've worked with public health, audit, legal, Budget and Risk Administrator's Office to develop this policy. And where it is actually effective retroactively back to June because it was voted up by 2/3 of the legislature, which makes it effective immediately upon the signing. In order for an individual to be quarantined, it has to be on the recommendation of the county's local health authority or their designee. So that is Dr. Colquitt or her designee. We do allow that a department supervisor can quarantine somebody for up to 2 days while they work through the process of getting possible health authority approval. This also makes the individual eligible for reimbursement for reasonable cost related to that isolation, including lodging, medical, and transportation. And as I said, this is a benefit for those individuals that are peace officers, detention officers, emergency medical technicians, and the individuals will receive their base rate of pay during the time that they are quarantined or isolated. I'm happy to answer questions.
Does the policy define communicable disease?
It does not, nor did the legislative
The common
direction.
cold is a communicable disease.
It does have that. Oh, I'm sorry. Leslie says it does. I did not bring that with me. But we did have discussions about that. But no, it wouldn't be something like the common cold. I think it would be, and I think the local health authority would be the individual that would weigh in on that. And Leslie may have something to add. I don't know if she would.
It's the communicable disease definition from the Health and Safety Code.
Oh, you're correct, yeah. And we do have that. And it says, it means an illness that occurs through the transmission of an infectious agent or its toxic products from a reservoir to a susceptible host, either directly or as from an infected person or animal, or indirectly through an immediate plant or animal host, a vector, or the inanimate environment that is required to be reported to the Texas Department of Health.
That help?
Not much.
I think a cold still may sneak in there.
Yeah, of course, the local health authority will.
It's that required to be reported part.
Right. So that's exactly. And so, yeah, we did include that definition in our policy and had discussions with public health on this before, completing this policy.
So the policy specifically lists a number of positions: peace officers, detention officers, and emergency medical technicians. Approximately how many emergency medical technicians do we employ?
One.
Okay.
And it's actually a vacant position, but we have one.
Very good. Thank you.
Any other questions? Do I have a motion and a second?
Move for approval.
So what happens if we don't do this?
I guess you'd have to ask legal. We were required to develop a policy. That's what the House bill gave us direction to, and the House bill amends the Chapter 180 Texas Local Government Code.
Do you need a second?
I do.
I'll second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
All right. And Ange Ramnarine will do the next item. Thank you.
Hello. We are here to seek approval of the external lateral transfer policy for the Sheriff's Office, effective September 11th. The policy here would apply to deputy sheriff applicants in the patrol division only. This is a common policy throughout law enforcement agencies. Some do have them, some don't, but it is common. The department believes that our starting salary restrictions and our lengthy training processes cause us some issues with recruiting experienced personnel. So what we're looking at with the proposed policy is the ability to offer licensed and currently employed Texas peace officers a higher starting salary, along with the ability to shorten the field training process based on their experience. The fiscal impact of this program before I move on to actually explaining some details. Is unknown, the usage is unpredictable, but we believe it's not going to apply to more than 5 to 10 employees per year. The fiscal impact will be absorbed through the department's salary budget.
So let me ask a question before you go too much deeper into this. We're doing it for patrol. How many vacancies do we have in patrol?
Last time I checked, 5. How many do we have now? 9 now.
And why would we do it for just patrol and not do it for our big problem, which is the detention area?
So there aren't deputy sheriffs in detention?
Well, there are employees. Let's not.
There are.
Do we do it for employees in the detention area?
We don't. Typically, these policies apply to peace officers, so we're not looking at it for detention officers.
And where do we have our biggest number of vacancies?
Would be detention.
And we're incentivizing, trying to put incentives in place. I mean, I don't have a problem with it being done in patrol. It seems to me like if we've got experienced people coming from other counties or from other places, that those years of experience should count. But I just don't understand why we're only doing it for patrol and not also doing it for the place where we've got the biggest vacancy.
I think the reason that happens, and a lot of times this is in police departments, not sheriff's departments, the lateral transfers, they really don't have detention officers. What we might want to do is to, if the court wants to, is to approve this policy, then let us go back and look at the detention officer issue that you raised and see if we can do something there also.
I'll move approval of that.
Second.
We have a motion and a second. Any further discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you.
Thank you, Ange.
Amber will do the last item.
I've got a list of questions for you.
Good afternoon. We are seeking the court to approve fertility preservation for iatrogenic infertility as a covered benefit under the PBC medical plans effective January 1st, 2022. On August 25th, the PBC Board of Governors did discuss and approve this addition of fertility preservation for both the HDP and PPO medical plans. Any questions related to the fertility preservation?
Move for approval.
Second. This really pertains to someone who has cancer or is...
Right. It's basically resulting from chemotherapy, radiation treatment, or bilateral oophorectomy, which is the surgical removal of both ovaries.
Thank you. Any other discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you.
Thank you, Amber. Purchasing, Melissa, come on down.
Good afternoon.
Hey, Melissa.
We have 8 items for your consideration. The first item is an award recommendation for bid number 2021-093 for air handler and boiler replacement for facilities management, awarding to Haynes Humphrey in the amount of $1,228,924. If approved, we're also requesting contract approval and acceptance of the payment and performance bonds.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
The second item is also an award recommendation regarding bid number 2021-105. This is a sub-courthouse in Arlington finish out and renovation for facilities management, awarding to Construction Zone of Texas in the amount of $1,186,574. If approved, we're also requesting contractor approval and acceptance of the payment and performance bonds.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
The third item is an award recommendation regarding RFP number 2021-114. This is our annual contract for printing and mailing of absentee ballots for elections administration, awarding to the primary vendor MPC and the secondary Fort Orange Press. If approved, we're also requesting contract approval.
No, neither one of these vendors is the one we had a problem with that
No,
printed the ballots.
both new vendors.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Make sure they don't have any inkjet printers.
The fourth item is an award recommendation regarding bid number 2021-118. This is an annual contract for overhead door and bifold door preventative maintenance and repair for facilities management, awarding to DH Pace Company per unit price, hourly rate, labor rates, and markup for parts.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
The fifth item is an award recommendation regarding bid number 2021-134. This is our annual contract for traffic control equipment for all precincts, awarding to the various vendors listed in your court communique per unit price and discount from list price.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
The sixth item is a request for approval to utilize the temporary health care personnel for public health with the two vendors listed in the court communique through September 30th, 2021. The original contract we were using expired last month, and we're working on a new contract to be awarded the first week of October. So we wanted to continue on with those emergency staff members that we have.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
The seventh item is regarding RFP number 2021-112. This is RFID Asset Tracking Solutions for Information Technology. We're requesting rejection of all proposals and a request to rebid with revised specifications. The responses that we received were varied, and it was determined that we needed to clarify the specifications a little bit more.
Move approval.
Second.
We have a motion and a second. I'm assuming that if there is an SAP solution, that information technology is looking at that?
There is not an SAP solution for RFID tagging.
Okay. Any further discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
And the eighth and last item is regarding bid number 2021-124 for sanitary sewer replacement for facilities management. We're requesting a rejection of all bids and request to rebid with revised specifications. Only one bid was received, and it was $2 million over budget.
That'd be a good reason to reject.
Yeah.
Move approval.
Second.
We have a motion to second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you.
Thank you. Commissioner Johnson, I believe you have an appointment for today.
I have two. One to the River Oak Stirs. I want to appoint Alice Moore. You want them both?
Well, we got a motion and a second for Alice. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
I have a CPS appointment. Leslie M. Baker. Move for approval.
Second.
We have a motion and a second for Leslie Baker. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Any other appointments? Then you have before you the claims, including the addendum.
Move approval of the claims, including the addendum.
Second.
We have a motion and a second to approve the claims, including the addendum. Any discussion? Please vote. Commissioner Johnson? Commissioner Johnson?
I had a question.
About the claims?
Yes.
Okay, I'm sorry. Go ahead.
Weren't we supposed to hold up on this?
No, what GK had indicated earlier is he just wanted us to be aware of the fact that if the claims were approved, that they would not immediately go, that certain ones would not immediately go out until the auditor had had a chance to do some additional work on those retaining to rental assistance.
Okay.
Commissioner Johnson?
Yes.
Motion passes unanimously. Additional briefing items, Mr. Manius?
Yes, we have one additional briefing item, and that is going to be item B, which is the FY22 budget. And as we get ready, I'll hand this out for you. As we move to that, just want to make sure or notify the court that we will not be going into closed today.
You will not what?
No, sir, we will not be going into closed session today.
Commissioner Johnson, I have to apologize. I did not email this to anyone, so you do not see what I'm presenting to the court today. I just realized it.
Okay.
Taking a cut and pay here, JD.
Do what?
No, not. Nothing. All right.
So, there are just a few items that that have changed since we had the budget hearing, and you should have that in front of you now. And it is on non-departmental. There is an operating transfer to capital for $1.1 million for phase 2 of the LIMS project that has continued to go up in cost.
Remind me what LIMS is?
LIMS is the Medical Examiner's Management System.
Okay.
In addition to that, the auditors informed us of $2 million in additional cash, and that's why you see the undesignated going up to 976, because the additional amount of that $2 million went up to cover the LIMS project. And then the others are not as big. There was a reclass withdrawn by the Sheriff's Office. There was a removal of a double fill position for a clerk in JP4 after it was vacated. And then transportation, we moved money from professional services to grant match for the City of Everman flood project. And the M0214 grant, which is actually the precinct's grants for various types of construction highway projects that are being submitted. And it's just a continuation. That was done in 2021 through transportation, and this is just to continue on some of the projects. And that's it. Those are the changes. Do we need to?
Yes.
I think yes.
We need to. This is a temporary approval that in order for it to be included in next week's budget.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Thank you, Helen.
Your Honor, we do have 3 more participations.
Yes, we'll take those at this time. First is Doreen Geiger. Good morning.
Good morning.
The case may be.
Thank you very much. During the last 3 months, the media has reported that some people inside and outside of Tarrant Regional Water District were complicit in attempting to misuse taxpayers' money. Please refer to the Texas Constitution, Article 3, Sections 44, 50, 51, 52, and 53. Fortunately, the Water District Board of Directors at the last minute stopped the payment of a $300,000 gift to Jim Oliver, the former general manager, and a $60,000 gift to J.D. Granger, current executive director of Panther Island. These attempted gifts are just a tip of the iceberg of the problems at the Water District. Tax-paying voters on the right, on the left and in the middle deserve a full forensic audit of the Water District and the Trinity River Vision Authority. The audit should be from an independent CPA firm with experience in performing forensic audits and one that has never audited the Water District or the Trinity River Vision Authority before, and that has no formal or informal relationship with any Water District board members, staff, or contractors. Judge Whitley, Commissioners Brooks, Allen, Fickus, and Johnson, very respectfully, I ask that you recommend to the Attorney General, District Attorney, the District Attorney to have this audit performed. Thank you very much.
Thank you, Ms. Geiger. Is it Geiger?
Geiger like the counter.
Thank you very much. Next, Thomas Torlincasi.
Judge Whitley and Commissioners, I really appreciate following Ms. Geiger like a counter. I appreciate that a lot, in part because I wanted to come and apologize. My experience the first few times I addressed the court, I was a little rough on you as far as how you conduct open public meetings. We need to work a little bit more on that 551.007 part, but let me tell you some things that you don't do. You don't scan the license plates of citizens when they're coming to a meeting. You don't require them to sign in to a public meeting just to sit and observe. You don't run their plates while they're speaking in front of the Commissioner's Court. You don't check them for warrants. You don't have your private police officer approach a citizen in a public space when they ask the question, why do we have to sign in to a public meeting? You don't have county employees run text messages between the general manager, the fake chief of police, and a number of other employees, including board members. You don't do any of those things at an open public meeting here at the county. You don't mock that person while they're speaking. You don't call them excrement. You don't threaten to kick them like the police chief at TRWD did. All those things that I described, that's what they do at TRWD. Now you got to ask yourself, scratch your head for a minute. Why in the world would they do that? What's going on? Why is it that when someone walks in the door on July 28th for the first time, they have that treatment? I had to FOIA request the text messages, and it's outlandish what they did. But here's the reason why. Because there really is a criminal gang over there. I know that sounds ridiculous and dramatic. Most of those contractors and most of those long-term employees still loyal to Jim Oliver, they live in Commissioner Johnson's district specifically. The police chief isn't certified by TCOL, but he calls himself a chief, which is actually a violation of code. The number of invoices, as I mentioned before, is outrageous. But I'll give you one example. When you drive in the gate at TRWD at 400 Northside Drive, every one of your license plates will be scanned by a license plate scanner. And that license plate scanner is on top of a pole, which is on a concrete pedestal. The material costs of that concrete pedestal and that pole are approximately $300. But a crooked contractor was paid $2,400 just for the concrete and just for the pole. That contractor, directly connected to Kay Granger, has hundreds of invoices that are questionable or work that he actually did not perform. Do you want to know what they're hiding over there? Maybe somebody better find out.
Thank you, sir. Next is Arnice Chandler.
Please bear with me. I do apologize. I stayed up late last night writing this information so I could have it today. So, my name is Arnice Chandler. I formerly, excuse me?
Chandler, would you please raise the mic?
Oh, sure. Yes, sir. Is that better?
That's much better.
Okay, thank you. Good afternoon. My name is Arnice Chandler. I formerly worked for the Austin Travis County Commissioners Court as the agenda coordinator, and also for the City of Austin City Council as the department of city attorney. I was also the agenda coordinator. I am standing before you today to plead for your assistance in obtaining a criminal background investigator to handle my case, which I have filed with the police department in the city of Fort Worth and also the city of Austin. And I have not been able to get any assistance because I believe I have been discriminated against because I'm a black female. I'm also part Indian, and I am in desperate need of your help. I went to the police office I'm not from here, I'm from Austin, really Oklahoma, but I went and talked to the commander over at the police station in South Austin, and his last name was Ramirez, and I have not heard anything. The reason I am desperate at this time is because I have been brutalized, I have lost 10 children to abortion, I have been sex trafficked, I have been human trafficked, I have been prostituted. I have been a person involved in family and domestic violence. I've had a gun pulled on me. I've been sexually raped and impregnated and intentionally made by these individuals to have abortions, up to 10 abortions. And so I am very upset at this point. I feel I need your help, and because no one is taking me serious. These people are still trying to locate me and to murder me and my children. Because 19 years ago, when I finally got away from these individuals, I met a very nice man. His first name is Stephen McDonald. And we had a son 19 years ago. And for the last 19 years ago, since the last 19 years, I lost my job at Homeland Security, at FEMA, and I was working for Texas State Department of Emergency Management. I walked off of my job. I had a nervous breakdown. I have suffered a stroke. I have suffered a heart attack on the job, and I have suffered a hysterectomy because this man is a monster, and he is battering me because when we were together, he was a cocaine addict, he was a crack addict, he wouldn't work, he wouldn't pay any bills, he had no responsibility, and he wanted the sex, but he didn't want the seed. And I was very young and impressionable at the time. I felt like I worked for the city attorney's office, so I felt like the world was at my hand and that I could do anything. But this man's jealousy and rage was based on the fact that he was gay, and I didn't know it. He was bisexual, and I didn't know it. And he was a male prostitute. And the worst part of it all to me, which is an abomination before God, is that he's sleeping with his sister, Sharon Bradford Mahone. His other sister, his youngest sister, aborted a child when she was 7 months pregnant, just because she was angry at the father and wanted to pay him back. This is so terrible. They sold drugs, they distributed drugs, they tried to get me on drugs. I would break up with him and we would go back and forth, and I could not get rid of this person or these people. Him and Lester Ray Maddox. Lester Ray Maddox, he is another abusive person. He was married and forced me to have 2 abortions. He took me to the abortion clinic. He was married to Loretta Hill. I didn't even know he was married. He lied about that for years, and I am sick and tired of them.
Ms. Chandler, yes. Your 3 minutes are up, but here's what I'm going to say to you.
Okay.
Because it's not on the agenda, we cannot address you.
Yes, sir, I understand that.
At this point in time.
Okay.
But what I would like to do is I would like for you to talk with our district attorney.
Yes. But Judge, you know what? I do apologize. I understand you want me to talk to Ms. Wilson, but you know your office has battered me. They have not been helpful to me. They have left me out, and I am falling through the cracks, sir. I am very upset. But I understand. I'll talk to her. I didn't talk to her.
Well, that's Leslie Hunt. That's
yes,
not our district attorney over
I
here.
talked to her assistants, and they were not helpful at all.
I would ask that you please try one more time.
Yes, sir.
And apologize, but 3 minutes is the...
Yes, sir, I understand.
Okay, so thank you very much.
Yes, sir, I will speak with Ms. Wilson. Thank you very much, sir. You have a good day. Bye.
Have a good day. I believe that's all the
No,
business
that's all
we
we have
have
at this time.
today, so with that, we'll stand adjourned.